I think that's a great thing you've done, Don. I think that's not necessarily an easy task to share your story, and I'm sure, as Don said, it struck a few chords for all of us at some point along the way there. So thanks, Don. And I think that's quite useful as well to those of us who maybe aren't touched by the disease directly, but who are in the industry, to bring it back to the family, or who aren't seeing patients, to bring it back to the reality that is being faced by so many of us out there. So thanks, Don. That was huge. So I was going to talk today at some point. I thought we'd cover a little bit about the foundation and give an update on where we're at, and just talk about some of the initiatives that we have going on. Just before I do that, I'll get my slide working again. Can I allow that, do you think, David, just so it stops coming up? It's not your computer, is it?
No, just allow for now, just allow, not always allow. I'm actually get it away for a while, I think.
I worked in IT, it's fine. There you go. And if it's not fine, it's not my problem. So, just if we could gauge, just quick show of hands, has anybody been to an information day before? A couple of you? Yeah, a few of you. Oh, that's great. Okay, well, it's nice to have you back. So there's quite a few who haven't been. So I might just give an introduction first about the foundation, if that's okay, and then we'll talk a little bit about some of the initiatives that we've got going on and some of the work we're trying to do to benefit you and some of the services you might have access to. So just to pitch it, why do we exist as a foundation? So we're quite bullish. We don't necessarily think that we're going to do this ourselves, but we exist to cure mitochondrial disease. That's, it's aggressive. We have to set an aggressive target. That's the purpose of our existence. And what do we do in terms of trying to cure mitochondrial disease? We've identified three major areas, and they're around research, support, and education. So we will actively fund research into mitochondrial disease. We'll provide support to patients and their families who are suffering from mitochondrial disease. We will educate the medical profession and the general public about mitochondrial disease. And that last point, those of you who have been touched by it have no doubt been met with the blank looks you get when you say to somebody the term mitochondrial disease. Most people have not heard of it, and even if they have heard of it, don't understand it. So we think that and that's not just the general public, it's often in the medical community, there's even a high degree of lack of understanding about these range of diseases. So those are the things that we do, and I try to keep things really simple. Obviously, we do a lot of different things and a lot of different complex things, but if we're trying to keep it simple, it helps us keep our focus. So really, that's what it's about: research, support, and education. So in terms of the research side of things, some of the work we've done in the past through our fundraising initiatives has been funding PhD scholarships. To date, we've funded 4 either full or part scholarships, and two of our scholars are actually looking to finish up this year, and we're looking at another one who will finish up their scholarship next year. And then the most recent one, Hayley, that's actually not a picture of Hayley. Hayley didn't want to provide a picture, but Hayley's just in the back there. Hayley away. And she's going red. There you go. So the scholars are a way of us to entice more people into the field of mitochondrial disease research, the scholarships. One of the things we know is while it is a growing field, we want to escalate the rate at which this field grows. So by offering attractive research scholarships, our objective is to bring more people into the field. So that's been great, and some of our scholars are really getting to the end of their tenure there and doing some great work. We've funded various other projects, like another initiative has been a clinical database to help manage the mitochondrial disease patients' clinical care. So it's being trialled at the moment in a clinic in Western Australia, and the idea is that we're trying to normalise and standardise the amount of data that's being captured about given patients, what their test results are, etc., so that we can then look to foster best practice within other mitochondrial disease clinics around Australia as they get up and running. There aren't that many, but and then the idea is with that more clinics can get up and running so that more people have access to a clinic. Because for those of you who may not be originally based in Melbourne, if you're based in metropolitan Melbourne, it's a real struggle for people outside of the major centres, and really outside of Brisbane, Sydney, Melbourne and Perth. There's not a lot of access to a dedicated mitochondrial disease clinic. So that the objective of this patient database is really to help that process there. So that's it's been a long haul. It's taking a long time, longer than we would have hoped, but we hope to get that progressing over the short period. David mentioned also that another funding recipient of Amdf funds was access to a high throughput genetic sequencing machine. That's a very long term, and I really don't understand it other than it does a whole bunch of things that were tests that were really complex and really expensive. It's trying to do masses of them at a much cheaper scale today. So by funding some access to this type of technology, we're hoping that the rate at which that technology then becomes more readily available in the research labs or in clinics is escalated. So this is really historically part of where your funds have gone, where you've provided funding through Amdf. This is the kinds of initiative that we've been able to fund. And one of the more recent ones was, as Don mentioned, this is the actual machine. I think that's from the desk there in the research lab here. There's another one sitting at the Colling Institute in Sydney, a research centre focused on mitochondrial disease. This is called a seahorse bioanalyzer, and it measures in one way or another the mitochondrial function in a sample. And these are very expensive. We didn't buy the whole thing, we contributed to it, but that piece of equipment now is available in 2 centres that are conducting mitochondrial research, and part of our condition of funding of that was making that available to other researchers should they wish to use the machine. So again, we're trying to just complement the research work that's going on into mitochondrial disease. One of our more recent initiatives, and we're looking to offer our first grant in this regard, is called an incubator grant. An incubator grant is really seed funding, so we will provide in relative terms a small amount of funding in the range of about $25,000 to $35,000. And as a researcher, this is the kinds of funds that might help you get an idea to the point where you can demonstrate that the idea has validity and that the idea could then be submitted to a larger funding body like the MHMRC, like the government or another private funding organisation, and really then attract a larger scale funding and then progress your research. So the idea of these incubator grants is really to kickstart some of these great ideas, and not all of them are going to work out, but some of them might get enough data to the point where they will they'll have a much higher chance and are much more likely to receive that larger scale funding. So it's really trying to kickstart those ideas, because that's where, let's face it, all this research and all these cures and all these treatments are starting with an idea somewhere along the line. So that's an initiative we're undertaking in the short term as well. The next initiative is indirectly related to research, and it's the Mito patient registry. So we talked about a database previously that's being put into clinical practice. This patient registry is in relative terms, a very simple initiative. It's about capturing the details and the contact details of mitochondrial disease patients, and having access to patient information in that regard provides a really good resource in many ways. It helps us in an epidemiological perspective, understanding how many people are there in Australia who are suffering from this disease on one hand, and then on the other hand we can look at how many people do we think are suffering from the disease, what's the gap, why are these patients either missing their diagnosis, misdiagnosed or not diagnosed, why is that happening? We can then start to use that data to influence policy, etc. So that's one of the major objectives of having a patient registry. So this will be launching in a couple of weeks, and we'd encourage you all, if you've got a connection with mitochondrial disease, to register with that. We'll go through a pilot phase where we'll test it out and then we'll open it up. So look for that over the coming weeks and months. We're really close to that. That's very exciting. Now, the other thing that having access to a patient registry, the other benefit there is, as the pharmacological treatments, etc., develop in their research from preclinical as they look to evolve into a clinical trial, having access to patient information who may be eligible to be candidates for participating in a clinical trial does fast track that research process for the drug companies and the researchers who are looking to develop drugs. We then become an attractive resource for the people, the organisations who are developing drugs, and we can not only fast track that, but then they can provide support to us in other means to help offer the services and the support services that we look to do. So the patient registry is a really strong initiative. We're looking at collaborating with other organisations like us internationally to develop an international patient registry. And again, having access to patients with a certain type of mitochondrial disease internationally, because the numbers really aren't high, does then open the doors to progress that research into clinical trial stage. So that's another major benefit of the patient registry. So all of these are the research-based initiatives that that the Amdf has been trying to encourage and to help drive along their way and just fast-track them a little bit, escalate them, make them happen a little more quickly than they would happen otherwise. The second element of what we do is about providing support to patients and families. If none of you are aware, we operate a helpline, and the helpline is free service to you. It's available at the cost of a local call. If you don't have that number, we encourage you to make use of it. It's operated by a volunteer, Dr. Karen Crawley, largely. Karen is a GP. She also has family members affected by mitochondrial disease. I never hear a bad thing from anybody who calls the helpline about Karen Crawley, and I've had feedback today from a number of people already about the amazing information and support that they've received. So it's not just meant to be a crisis situation. If you've got an emergency, you'll obviously call 000, but if you've got a question of how does this work, or am I understanding this right, or you want to float an idea by, we're happy to provide you with some information in that regard. Legally speaking, we need to be careful about providing medical advice, so we're providing information officially, but you're certainly getting some pretty good context about the information that's being provided there. It can go beyond medical information, practical information about access to community services and help facilities that are available, or just a sounding board, or somebody who's willing to listen to you if you've reached your tether. So the helpline is an amazing tool, so we encourage you to take advantage of that. A lot of our patients are deriving support through our Facebook group. We've got a Facebook group there. It's now got over 800 people who are members of the group, all have been connected with mitochondrial disease in one way or another. And it's an amazing resource for just maybe for those of you who are social media savvy. It's a great way to just float an idea up there. Hey, I've got this going on. Has anybody heard from that? And a lot of patients are finding some real support in that regard about communicating with other patients who may not be locally based. It's a great tool for us to have created for those patients who don't have access to services, etc. So again, I think with any public forum you need to challenge everything that you read, etc. there. And I wouldn't necessarily be using this as a sole source of medical information by any means, but practical advice on how you deal with things day to day. If you've got family members touched by mitochondrial disease, etc., this has proved a wonderful resource there. So you go to Facebook and you find it. That's the tip. No, you search for Australian Mitochondrial Disease Foundation. It's also available as a link from our website. So if that's your cup of tea, go for it. Support group meetings are also another initiative that the Amdf tries to facilitate, and primarily through the work of Joanne Edwards, who any of you who have been to a support group meeting here in Melbourne will know Joanne. So we encourage that, to meet and greet with other people who are touched by the disease, just to make those connections. And we often find people once have faced or felt vastly isolated. When they're touched by mitochondrial disease, they often thought that they might have gone through years of diagnostic journey, and they think they're the only person in the world who's got this disease. And what we've found is that sometimes for some people to connect with others who are touched by another, the same or another type of mitochondrial disease can be very, very rewarding and very supportive in that regard. So we'd encourage you to participate in support group meetings if you think that could be helpful for you. In terms of educating the general public and the medical professions, we have our website.